Good morning, everybody. It's Dr. Baker, and I'm here with Debbie. And Debbie had some multiple stem cell injections. We did her left knee, we did her right knee, we did her lower back, and then both her hands. So Debbie, start from the very top. How was your pain when you first came here in your back, your knees, and your hands? And tell us a little bit about your history.
Okay, well, I had a total knee replacement about a year and a half ago. I had nothing but trouble with it, had to have pain management, injections, all kinds of stuff. I was re-hospitalized twice. I had a lot of pain, a lot of swelling, and a lot of fluid in there. And so that was my right knee, and so I came to one of the little seminars they have here. And they wanted to replace my left knee, which they said was worse than my right knee, and they said it was bone on bone. And so that was also a problem for me. Plus I had this little knot in my lower left back, and I had burning in my hands, because I guess I have like arthritis, and I use them a lot. And so I had the stem cell injection in 5 places. And you come to these things, you think, oh, that really sounds good, but all these people are a bunch of liars. But the truth is that my right knee, although it still has some mechanical issues, I have no pain, no discomfort whatsoever, which was kind of like a godsend. My left knee we injected anyway because there was a little bit of cartilage left. And I gotta say that I think that's better. There's still some issues there, but it's only been 6 months. My lower and left back is like perfect, and my hands are, I'd say, 90% better. Every now and then I have a little trouble because I do upholstery and stuff like that. But if you can afford to do this, or if you can't afford to do it, it's the thing to do. If I think about all the money I had to spend outside of my insurance just to deal with trying to manage that pain, to not having any pain, I'd say go for it.
Okay. Thank you, Debbie. And I'll see you for your next follow-up, which will be in 9 months.
Okay.
Okay. Thanks, Debbie.
Bye.